Hello, I am Dr. Dhara. Today we are going to discuss medical certification of cause of death. It is a more of a practical class than the theory class. So let's start. MCCD is basically a part of an international statistical classification of disease. Registration of Birth and Death Act, which came in 1969 and amendment was done in 2023. It says that every registered medical practitioner who has attended the disease during his last illness need to provide a certification which is cause of death certification. Now, what is the purpose of this MCCD? It will help to identify the public health importance of different diseases at national and regional levels, help to make a decision on allocation of resources for controlling various disease and for research programs, to evaluate the trend in cause of mortality over time in order to assess the impact of national health programs, and help to analyze the socio-economic, demographic and lifestyle factors that are associated with deaths due to various diseases. Now, what this registration of birth and act says. It mentioned that every registered medical practitioner has to notify the birth as well as death within a 20 days of occurrence. It also mentioned that whenever there is a death in your supervision or in your hospital, you have to give that death certificate to the registrar, and that copy of that certificate need to provide to the nearest relative. Cause of death certificate has to be issued by a registered medical practitioner who attended the disease in his last illness without charging any fee in the prescribed form. A certificate in the prescribed form stating to the best of his knowledge and belief of the cause of death. If registered medical practitioner neglect or refuse to give this certificate, he can be punished with the fine up to 50 rupees. Now there is some duty whenever you are attending a person in terminal illness or who is already dead. First, as a doctor, you have to diagnose a death or confirm the death. Now, at the time of confirming or diagnosis of death, be aware of the suspended animation. Now, what is suspended animation? In suspended animation, we cannot measure the vitals of that person. Why? Because the metabolic rate of that person is so low that it is not measurable, which can be seen in case of electrocution, hypothermia, most commonly seen in newborn babies. Okay. After confirming the diagnosis of death, do pronounce death, and then as a doctor or any staff under you can fill up the form 2, which is a death report. Now, if you are sure and to the best of your knowledge and belief about the cause of death, fill up the MCCD, which is a medical certification of cause of death form and death slip. If there is any doubt regarding cause of death, like patient, the disease came brought dead, or there is any legal involvement, it is a medical legal case, cases of assault, suicide, accident, do inform the concerned authority for the further investigation. Okay, there is reporting of death and there is a certification of death. Both are the different things. Reports, there is a birth report, death report. Okay, this can be filled up by anyone, any person who has a knowledge of the event as covered under RBD Act. Form 1 is for birth report, Form 2 is for death report, and Form 3 is stillbirth report. But the certification, which should be only done by registered medical practitioner as specified by the respective state governments. Now there are different terms: mode of death, manner of death, mechanism of death, and cause of death. Okay. The mode of death, it is an abnormal physiological state that was present at the time of death. Now the function of the three vital organs, which are the heart, lungs and brain, need to be present. If any one of these vital organ leads to failure, it can cause death of that person. If the failure of heart, which can lead to the cardiac arrest or cardiac failure or syncope, it is a failure of lung, it can cause respiratory arrest or asphyxia, and failure of brain function, it can cause coma. Mechanism of death, it is a physiological derangement or biochemical disturbance that is related to the death of an individual. There are examples: vasovagal stimulation, metabolic acidosis, and septicemia. Manner of death, fashion in which the cause of death came into the existence or occurred. It can be natural or unnatural. Natural include any diseases, unnatural include any accidental suicidal or homicidal death. In our country, we need not to decide what is the manner of death. It will be decided by the court. Now, last, cause of death. The final condition include disease or injury or combination of both that initiate a sequence or chain of events that lead to the physiological disturbance, ultimately ending in death of a person. There are examples of acute myocardial infarction, intracranial hemorrhage, or bronchopneumonia. The acute cardiorespiratory failure, respiratory arrest, cardiac failure, coma, these are not considered as a cause of death because these are the mode of death. Now let's go over the process of filling out the cause of death certificate. There are two forms used for this purpose. One is Form 4 and second is Form 4A. Form 4 is used for the institutional death, meaning when the patient passes away while under your care within a hospital or medical facility, you are responsible for the completing this form. Form 4A is used for the non-institutional death. This applies in cases where the patient was under your care during their final illness but passes away outside the hospital. For example, if patient was discharged against medical advice and he went home and died, then you have to fill up the Form 4A. The first paragraph of Form 4 and Form 4A differ because they mean for the different type of death, which include institutional and non-institutional death. However, after the initial section, both forms contain the same field and the detail that need to be filled out. First, we see the Form 4, which include the name of the hospital. Then, I hereby certified that the person whose particulars are given below died in the hospital in ward number on, we have to mention date and the time. In Form A, I hereby certified that the deceased, name of the deceased, son, wife, daughter of the person, resident, was under my treatment from which date to which date he was under your treatment, and last, he or she died, date and time. Now, in next section, we have to fill some details. In first column, we have to mention the full name of the deceased. After that, we have to mention the sex of the deceased, whether male or female. And next, we have to mention the age of the deceased. And first, if the age of the deceased is more than 1 year, then we have to mention it here. If the age is less than 1 year but more than 1 month, we have to mention it here. If the age is less than 1 month but more than 1 day, we have to mention it here. At last, if the age is less than 1 year, then we have to mention it here. The cause of death is recorded in two sections, first and second. The first section record the immediate cause of death, which is direct medical condition that led to the person's death. It is followed by the antecedent cause, which are underlying condition or complication that contributed to the immediate cause over a time. The second section mentions the significant condition that did not directly cause the death but play a role in the death. Along with that, we have to mention the time period between that condition and the death. First, we have to mention the name of the deceased, then the sex, then age of that deceased. Now let's see how we need to mention the cause of death part. The final event that led to the death was intracerebral hemorrhage. So we have mentioned that in section A, which he was having for past 5 days. Okay. The condition that led to the hemorrhage was hypertension, which he was having since last 3 years. The root condition causing hypertension was chronic pyelonephritis, which was present for 4 years. The other significant condition present but not directly causing the death was bronchial asthma, which was present for 15 years. So this is how we mention all the details. In the next section, we need to document the manner of death if known. This refers to whether the death was natural, accidental, suicidal, homicidal, or it is still pending for the investigation. Now, if the cause of death was due to injury, we need to specify in this section how did the injury occur, whether there was a fall or accident or any trauma. Now there's following 2 points which apply only if the disease is a pregnant female. First one, that whether the death was associated with pregnancy, and the next we have to mention was there was any recent delivery was present or not. Lastly, we need to, as a doctor, we need to signature, mention our name, registration number, and the institute name. Lastly, date of the verification. As we see in the previous case where death was occurred due to intracerebral hemorrhage, which was resulted from hypertension, since this was caused by a natural medical condition and not due to any external factor or injury, it is classified as a natural death. And additionally, since the disease was male, the next 2 section, which is for pregnancy and recent delivery, are not applicable in this case. This last detachable part of the form must be filled out and signed by a doctor. This section is given to the deceased relative as an official document. This serves as a confirmation of death and may be required for legal administrative purpose such as obtaining a death certificate or handling a funeral arrangements. Now let's do some exercise. A 59-year-old male admitted with signs of gangrene on left foot had a swelling on the left foot and the fever for since 3 days. He had history of COPD and diabetes for 5 years. He also diagnosed with carcinoma of pancreas and operated for same 5 years back. He died in 2 days after admission due to sepsis. Now here, immediate cause will be sepsis, which was present for 2 days. Now sepsis was due to the gangrene of the left foot, which was present since 3 days. The condition that contributed to the gangrene was diabetes mellitus, which was present for 5 years. The significant condition present but not directly causing death, which was carcinoma of pancreas and COPD, again it was present for 5 years. The manner of death here will be natural death. Okay. Here in the section A it is mentioned cardiorespiratory arrest. As cardiorespiratory arrest is a mode of death, it never should be mentioned in an immediate cause. So the right sequence will be sepsis, gangrene of foot, diabetes mellitus, and other significant condition will be COPD and carcinoma of pancreas. Next exercise. Roopmati Devi, aged 30 years, grade 6, para 5, with gestational hypertension, reported to the emergency of Tara Nursing Home in her locality at 36 weeks of gestation on 30th September 2024. She had been complaining of abdominal cramping and vaginal bleeding with the passage of large clots since last 12 hours. A presumptive diagnosis of abruptio placenta was made. She continued to bleed per vagina as well as from phlebotomy sites, and she rapidly went into profound shock. No fetal heart sound were audible. Features suggested disseminated intravascular coagulation. Despite administration of blood and clotting factors, intravascular pressure could not be maintained. The mother and fetus both died within 1 hour of admission. So here, the final event that directly led to the death was DIC, which was present for 1 hour. Underlying condition that triggered the fatal event was abruptio placenta, present for 12 hours. And the other significant medical condition that play a role, which was gestational hypertension. Next, a 34-year-old female met with a road traffic accident being dashed by a car, had a crush injury to thorax 2 hours back. She was admitted in shock, having a profuse hemorrhage. She died in half an hour after admission from hemorrhagic shock. Being a medical legal case, the body was sent for postmortem examination. Findings were suggestive of multiple rib fracture with rupture of lung and other internal organs, resulting in hemorrhagic shock. Now, in medical legal cases, do not write cause of death as postmortem examination. If you have examined the patient and aware of the clinical finding leading to the death, you have to fill the cause of death certificate. In this case, road traffic accident which lead to the crush injury to the thorax, and ultimately the immediate cause was hemorrhagic shock. The manner in this case was accidental. The injury occurred as deceased was pedestrian and dashed by a car. She was a female, but the death was not associated with pregnancy. Next, a 64-year-old male, Manubai Krishnalal Chauhan, was admitted at AIIMS Delhi in ward number 2D, bed number 10, on the 9th September 2024, in a state of unconscious with history of fall from height 4 hours back. He had his history of bronchial asthma since 20 years. On examination, head injury was present. He was diagnosed to be having intracerebral hemorrhage and died on 13th September 2024 at 6 p.m. So here immediate cause is intracerebral hemorrhage, which occur as a result of fall from height. He also had history of bronchial asthma. It is a other significant condition but not directly related to death. Okay, so immediate cause is intracerebral hemorrhage as a result of head injury, and head injury occur as a result of fall from height. The last case, 27-year-old Nathubai Kanubai Yadav was admitted to Fortis Hospital, Noida in ward number 3E, bed number 10 on the 11th September 2024 in unconscious state with history of convulsion since 5 hours. He was detected as HIV positive 4 years back. He was taking treatment for pulmonary tuberculosis since 8 months. After admission, his CSF revealed tuberculous meningitis. Patient did not respond to treatment and died on the 13th September 2024 at 9 p.m. So the condition immediately led to the cause of death was tubercular meningitis, which occur as a result of pulmonary TB, which was since 8 months. Now, pulmonary TB was resulted as a condition of HIV positive. So, HIV infection leading to the pulmonary tuberculosis and pulmonary TB leading to the tuberculous meningitis. So, here the session is over. Thank you.